let's continue our discussion of the fungi by moving on to Aspergillus fumigatus. The word Aspergillus is way too similar to the word asparagus, so we went with making a picture about an asparagus farm. Also, fumigatus sounds like fumigate, and you'll see our scene is specifically dealing with a crop duster flying over and spreading its fumes over the asparagus farm. Okay, now that we've set our scene on the asparagus farm, let's start by talking about general characteristics of this fungus. One thing that some students forget about Aspergillus is that it is actually catalase positive, a concept that one might more readily attribute to bacteria. However, there is one other fungus that is catalase positive, and if you were watching the videos in order, you should remember that Candida is as well. And what's our symbol for catalase? That's right, a cat. So let's draw in this cat that's standing on top of this scarecrow. And don't worry, I'll get to the scarecrow later. Moving on to illustrate some of the other characteristics, we're going to draw this peanut plant up in the front here. Asparagus and peanuts on the same farmland? Well, I majored in agriculture, and don't worry, it's definitely doable. Now we chose peanuts because peanuts are associated with aflatoxins, which is a toxin produced by Aspergillus flavus. Notice I didn't say fumigatus. These aflatoxins are also associated with grain crops as well, which is why we have a wheat field drawn in the back here behind the scarecrow. So why is this toxin important to remember? Well, aflatoxins are extremely carcinogenic, especially for the development of hepatocellular carcinoma. So to help you remember this, we've drawn this cow grazing in the grain crop with a spot in the shape of a liver to remind you of hepatocellular carcinoma. Next to the cow is a huge tractor with a crab on it. Recognize this crab? If you think back to our H. pylori video, crab is a symbol for cancer. So just as with agriculture, turns out I majored in astrology too. Anytime a microbe causes cancer, you should definitely know about it because that means it obviously bears some clinical significance. So remember, Aspergillus flavus produces aflatoxin that causes hepatocellular carcinoma. Alright, let's turn our attention back to our peanut plant. Exams may try to trick you in your ability to distinguish Aspergillus from Eucor, strictly by its morphology. So let me pull up a picture of what Aspergillus looks like. Notice the hyphae of Aspergillus form acute angles, meaning that they're usually less than 45 degrees, such as those seen here. And they also have these septations, which admittedly are difficult to see in this picture. We'll help you remember this in two ways. First, notice we've drawn in these stems of the peanut plant here to illustrate acute angle branching. The angles between the stems are definitely under 45 degrees. See how we've also drawn in these septations here as well? To hammer this in even more, just think about the word Aspergillus. The first two letters are A and S. A for acute and S for septate. And that's not a sketchy approved mnemonic, by the way, so let's keep that on the DL. Okay, on to transmission. Aspergillus forms conidiophores, which are these fruiting bodies. These conidiophores sit at the top of the stalk here and get released into the air and then are inhaled by humans. This is actually how Aspergillus gets its name, because this stalk with the conidiophores looks a lot like an aspergillum, which is this thing here, a tool used to sprinkle holy water. So among our peanut plant, we've drawn some yellow flowers full of these fruiting bodies that are meant to look like the Aspergillus stalks. Also, these will remind you of the transmission, which again is that they bud off, float in the air, and then are inhaled by humans. Alright, now we're getting to the meat of it, the clinical symptoms. When we discuss Aspergillus, you should remember that there are 3 types of infections it can cause. Each type is going to be illustrated by one of our farm workers. The first infection is called allergic bronchopulmonary aspergillosis, or more conveniently, ABPA, which we'll write up on the crop duster here. The migrant worker affected is directly below, and this type of infection is a type 1 hypersensitivity reaction that causes wheezing, fever, and a migratory pulmonary infiltrate. So notice that we've made this farm worker migrating, i.e. running. He is also breaking out into a sweat because of his fever, and lastly, you'll see in his hand that he has this inhaler to demonstrate the association of ABPA with asthma and wheezing. And on a side note, ABPA is also associated with CF patients. Furthermore, blood tests of patients with ABPA will show increased IgE, which makes sense since these are type 1 hypersensitivity reactions. And if you look closely on the inhaler, we've written in IgE. Okay, let's talk about our second type of infection, which will be demonstrated by the farm worker on the left, who is coughing into a napkin. This infection is responsible for the formation of aspergillomas, or fungus balls, and they are exactly what they sound like, solid balls of fungus within the lungs. And this is what it would look like on chest x-ray. People who are susceptible to this type of infection are those who may already have cavities in their lungs. So think of people maybe with TB or with Klebsiella. So let's draw a cactus right here on the left. And recognize this cactus? That's right, it was in our TB video, and it's supposed to help remind you of the association of aspergillomas with TB cavities. And to really illustrate what goes on in these cavities, we have these cavities filled with these peanuts. You'll also notice that these peanuts aren't just floating around in the cavities, they're laying at the bottom. This is because aspergillomas are gravity dependent. So in an upright chest x-ray, the fungus balls will be at the bottom of the cavity. Now remember that TB isn't the only thing that causes cavitations. Some lung cancers do, Klebsiella, and some other systemic fungi do. But we've highlighted TB because that's probably the one that's most tested. Alright, well, we saved the worst for last. And that the last type of infection we're going to talk about is definitely the worst, and it's called angioinvasive aspergillosis. And it occurs in the immunocompromised, which is demonstrated by this farm worker on the right, who we will draw, of course, holding our immunocompromised cane. The specific subgroups of immunocompromised we want you to think about are patients with neutropenia from leukemia or lymphoma. As its name implies, angioinvasive aspergillosis invades blood vessels and disseminates very quickly throughout the body. And you can actually see this on light microscopy. The acute angled septate hyphae would be visualized invading the vessels and the surrounding tissues. So we'll help you remember angioinvasive aspergillosis by drawing this sprinkler system that the farm worker is standing next to. The red hoses of the sprinkler system represent vasculature and is located throughout the asparagus crops. Notice this immunocompromised farm worker standing next to the sprinkler system also has fever, cough, with hemoptysis as well. Well, there's more to it than just that. Remember, I did say it was the worst. Because of its ability to disseminate, many other organs are affected as well. And we'll illustrate all of these organs on our scarecrow. Finally, we get to them. Notice we've drawn some straw spots where his kidneys would have been, a straw heart, and some black dots on his head with some white rims around him. Invasion to the kidneys ultimately leads to kidney failure. The black heart is to represent endocarditis, and the black spot with the white rim around it in his head demonstrate ring-enhancing lesions in the brain. So if a patient is presenting with seizures or focal neurodeficits, has a cough and symptoms of pneumonia, and in the past has had TB, you may jump directly to TB, but you also have to keep aspergillosis in the back of your mind. And the way you'll tell this is seeing ring-enhancing lesions on CT. The fungus can also spread to the paranasal sinuses and cause necrosis around the nose, drawn here with a black dot. This also occurs in mucor as well. So don't automatically assume if you see an immunocompromised patient with necrosis of the paranasal sinus that it's aspergillosis. It could also be mucor, which is why we stress the importance of remembering that aspergillosis has acute angled branching versus mucor, which has the right angled branching, which is covered in our mucor video. Okay, to wrap this fungus up, let's talk treatment. For the less serious infections, you can use iconazole, just like our other fungi, and our symbol for iconizoles were pine cones, which we'll draw into the left of this sketch. However, for Aspergillus infections, exams can be somewhat picky as to specifically which azole you would want to be choosing. We thought it was important to specify in this drawing, so the iconazole that we're going to go with is voriconazole, which we've illustrated here with a vortex in the back. And we've sprinkled in some pine cones into the vortex so that you really remember voriconazole. Another point of caution is that aspergillomas will actually need to be surgically debrided in addition to medical treatment. And there is one other caveat. For angioinvasive disease, you'd use a different medication. A deadly disease requires a big gun, and you hopefully should guess by now that this is amphotericin B. We'll illustrate amphotericin with amphotericin amphibians, which are these frogs here in the front. And that wraps up Aspergillus. Key points to remember are the acute angle branching, and that Aspergillus flavus produces aflatoxin that causes hepatocellular carcinoma. Also know how to distinguish between the three manifestations of Aspergillus infections. Those are allergic bronchopulmonary aspergillosis, aspergillosis causing aspergillomas, and angioinvasive aspergillosis. It's quite a tongue twister. Anyway, good luck to you.